Opening up. As founder and CEO of Somai Pharmaceuticals, Michael Sassano heads up one of the world's leading multi-country cannabis companies. We hear more about the opportunities he sees as Europe's cannabis markets open up. Hello and welcome to the Lobsterpot podcast. I'm Dave Barton, and today I'm joined by a gentleman, Michael Sassano, who is the founder and CEO of Somai Pharmaceuticals, who you may have heard of if you're based here in Europe or beyond. They're one of the biggest medical cannabis companies in, well, not just in Europe, but probably globally. But good to have you, Michael. How are you doing today?
Everything's great. Thanks for having me. And I'm calling you this time from Lisbon, Portugal.
Excellent. And so what's your journey? How long have you guys been established, and how did you end up in Portugal for the business? What was the driving force there?
Yeah, back in 2020, just as COVID was hitting, I was looking to bring the cannabis know-how from the United States, the companies I had done there and built over there. And we went around. I'm half Greek. I thought we were going to end up in Greece. But the regulatory framework didn't work. And just before the COVID hit in 2020, I went to Portugal, understood that there was a great infrastructure here, companies like Tilray, Cleaver Leaves, like a nice infrastructure. The regulators liked what we were doing. They believed in supporting us. And so we started construction about June, or we got the building in June of 2021. And started construction in September of 2021. And now in 2024, we have products in the market in 3 countries with 7 additional with pending regulatory approvals. So it's been, a journey.
Yeah. And again, just more broadly, medical cannabis is such a big topic, particularly in Europe and in the UK as well. So what was it kind of brought you to Europe? Just seeing the opportunity as the sort of different markets are opening up, and obviously sounds like you've been able to kind of capitalize upon that, which is quite interesting. It's a good place to be right now.
Yeah, I mean, on one side, I'm European. I've lived out in Europe since 2001, and I went back to the United States around 2015 because some of the investments we had in cannabis weren't performing, and I had to take on a managerial role, an operational role, and learn all of that. And so, spending 5 years on the West Coast, revamping the businesses we had out there, building new ones. To date, my brother and I built 25 facilities and cannabis facilities, and so. I wanted to get back. I had been out there, living in Las Vegas and flying around all the states, watching them all open up, participating. And I thought that Europe it was a good time to bring products to Europe. And, what a time we're living in now, as a matter of fact, probably the best timing I ever made.
Yeah, no, absolutely. But again, how did you find that sort of transition to go from the kind of US opening up different states and things, both medical and I guess recreational to some extent, and then kind of find yourself over here? Do you see a similar pattern, or is it very different culturally? Do you find sort of regulate from a cultural and from a kind of regulatory perspective, Europe versus the US in that regard?
Yeah, I mean, not to simplify it, but, there's similar trends. You're talking, the United States was a state-by-state regulatory trend, right? And so what started off as medical, and you were making oral drops and soft gel caps in the early days, quickly transformed to what you see today, a $32 billion market, 1/3 of which is still medical. But, the products are diversified to gummies and vaporizers and concentrates and all of that fun things. I think the same thing is happening here. So you have countries all moving at different paces of opening up the regulatory phase. Your 3 big ones, Germany, Australia, and the UK, let's say, and they're all on different paths of growth and different paths product acceptance. And so some countries, will be dominant with flower, but then you have new countries like France, Spain, Brazil, which are extract-only markets.
Right.
And so each country has its own nuance to its regulatory opening. But then I kind of like to break them down really simply into medical hard, which is, only a few clinically proven indications, like in Ireland, multiple sclerosis, epilepsy, stage 3 cancer. And then you have medical light, which would be Germany, where any GP can prescribe cannabis for almost any ailment. So that could be stress, anxiety, pain, multiple. And so it just depends on their level of acceptance. And I think they're all gravitating towards opening up access more and more.
Mm-hmm. And do you think that's kind of driving, particularly in Germany at the moment, the kind of appetite for regulatory stuff? I mean, sorry, for the legal for adult use markets, because it feels like, everyone I've spoken to in the past who, particularly people in Canada have sort of said, what happened? We had a robust medical program first, and then that kind of laid the path for the adult use. And that kind of feels like that's the case in Germany, although I hear things are sort of on the rocks a little bit. But I mean, would you agree that provides the opportunity? I mean, it's not to kind of denigrate the medical market, but again, that's it lays that foundation, do you think?
Well, I mean, what is, the difference, right? If anybody could get a prescription and fulfill that prescription, isn't, just because there's a doctor in between, is that necessarily not are people not making their choices? What would be the difference is how you actually purchase it, right? So you actually can purchase without a doctor's prescription, and you could purchase with just your ID, just like a beer,
Mm-hmm.
Example. And so I guess, there, in my mind, there's not really a big appetite for what you would call traditional recreational markets like California and other states in the United States. This is more of a political and regulatory issue. Medical's a layup. It makes sense. There's a framework. You have large distribution networks with pharmacies. I think, it's a big question how much access will open up and how much will there is for people to do it in those countries. So, I think at least minimum access should be all over the place for a medical light format, for cannabis, and that anybody who wants it for whatever indication should be able to get it. And then we can see if we can gravitate towards a something looser at a later stage, more than likely.
Mm-hmm. Because again, I've been hearing that, the actual move towards adult use in Germany has really kind of helped kind of push the envelope for medical cannabis as well. And I like to think, well, here in the UK, we have a kind of, well, as you probably know, because you guys have just started branching into the UK market in partnership with Relief, isn't it?
There's a few, yeah, but Relief for sure.
Yeah. And one of the things that always kind of strikes me is that, well, here in the UK, we've got, 67 million people and something like 40,000 patients, which is, as a percentage, absolutely nothing really. And as we look to kind of increase access, I mean, again, for all the sort of, what did you say, medical light sort of reason, again, you can get prescription cannabis for a variety of kind of ailments, like you say, everything from depression, rather, as well as the kind of, the medical hard, as you mentioned, around, epilepsy and multiple sclerosis and cancer. But again, what's interesting is I feel like the path to both is still fairly rigorous for most people to kind of go through here. You need to kind of have sign off, from, well, you need to kind of link your medical records, and you need to be able to prove that you've had 2 different types of treatments for whatever condition you're qualifying for. And that, I think, for a lot of people still puts, significant obstacles. It's not so much the stigma, but it's more about that process of actually saying, well, I've actually tried these 2 different treatments and I qualify because of that. And that seems to be one of the biggest, I guess, prohibitive factors here in the UK. What's your kind of perception of how it sort of stacks up against other nations that you're working in?
Yeah, for sure. Like, that if you juxtapose what kind of opened that really up was they took that narcotics derivation off.
Mm-hmm.
So it's no longer considered a narcotic, which means that there's no longer all that paperwork and risk associated with prescribing a narcotic. And then, of course, the UK, you have specialists that can prescribe, so
Yes.
that you still can't prescribe. So these are massive limiting factors,
Hmm.
including, causing bureaucracy and structural issues with how many documents you have to fill out and explain, and how that gets through the medical system. I think, when you look at Australia as an example, I think they're a little more advanced than the UK, a little bit less advanced than Germany. So Germany being one of the most advanced to open access. Australia may be number two, and let's say number three would be the UK of
Hmm.
those countries. And I think you know it's typical of all these cycles, where you start off with a very strict policy, and then you gravitate as you realize it's safe for your population, because the
Hmm.
regulators are just thinking, how do we do things safe? And although we can't agree with how they're doing it,
Hmm.
that's their basic perception. And then, of course, some of them, as we know, are probably, you know, catering to the big pharma groups, unfortunately, a little too much. But regardless, let's just assume that, everybody has the good, is trying to do the best they can for the population.
Hmm.
As more data comes, and as more comfortable, they get more comfortable, they gravitate towards lighter rules and
Hmm.
loose. Even the UK has loosened up, not even just by accident, I would suppose, not by some major decree,
Hmm.
because things have become a little bit more flexible for people to get their cannabis, not by any structural change, because your numbers have been going up, oddly enough, over the last many months. Where did that come from? Where did all of the patients come from in Germany? It's not like somebody suddenly had a big fit, and everybody started to get serious ailments.
Hmm.
No, they just became simple for them.
Hmm.
And then, obviously it'll open up even more. So I think what you're seeing is almost every country in Europe right now is debating, or pushing forward, opening up the access more.
No, I think it's a really interesting summary, and I think that's very fair summary as well. I think the more I think about it, the more I think around. I mean, again, everywhere has their own kind of issues. That's the thing. Nowhere's perfect. Nowhere's kind of getting it right, and it is kind of through trial and error, and through looking at sharing those best practices with other countries and other businesses, which is again why I think a lot of the media out there, a lot of the events and things like that are really useful for comparing notes and saying, well, we did it like this here, how and I mean, do you find is it kind of hard to kind of sort of stay on top of, like, where's next, or when you're kind of building a strategy, because at the same time you have an idea of where there's appetite for medical cannabis and where to kind of expand into, but things can just be pulled, the rug can be pulled out from under your feet at any moment, right? How do you kind of plan for that?
I think the rugs, many rugs were pulled out of our feet early on, and we kind of understood where the turbulence was coming from
Mm.
over the last, let's say, 2 decades. But slowly but surely, these blocks that are being thrown at us are being taken out. So let's just take this year as one simple example.
Mhm.
At the beginning of this year, the HHS released a 252-page report. That's the US FDA,
Yeah.
outlining that they studied over 2 decades, 6 million patients, 30,000 prescribing physicians, and they deemed that cannabis was safer than the alternatives in the market. And they also went on to say it's good for at least 15 indications, and cited neuropathic pain, Crohn's, anorexia, and quite a few others. And so, that's the government saying, here is the data, pay
Mm.
attention. And I don't care what country you're in. If you don't pay attention to that kind of a data set, there's something wrong, because in order to get that kind of a data set for the safety of your population would take decades and decades,
Mm.
just to get. Um, and then you had Germany come on, as we pointed out. They knocked out that narcotic rule and said, look, this is safe for our population, and it's better. It's better for us that we decriminalize and make this more available, than keep prohibitioning it. And
Mhm.
that was that's a major shot across the European markets. And I think what you're going to see, although I was a little disheartened that it didn't happen before the elections, I do still believe there's a very high probability that the U.S. will reschedule, sorry, to a Schedule 3. And I think you'll see other things start. Now, what does that do? That knocks out a lot of arguments about safety for the population for regulators and politicians. So the ones that are either on the side of big pharma or simply have some inherent bias that hasn't been able to be eradicated yet, are still holding on to the fact that, okay, there's some demonization. Well, I think, most intelligent people agree that there is medical benefit to cannabis, and it's much safer if you have chronic pain than taking oxycodone, as an example. I think most intelligent people can agree on that. But those pillars get knocked out, there's less argument on that political and regulatory realm. And I think most of them have been knocked out, and now it's a matter of will and pushing it through. And I think that's what you're seeing now. So I'm less worried that we're going to go backwards. As a matter of fact, I'm not worried at all we're going backwards. This year, I've been coining as one of the biggest medical movements in cannabis globally. And I even wrote a piece where I was looking at all the countries that have some legalization, albeit very strict. And what I saw, I didn't even realize there was almost 50 countries where there was some sort of way to access medical cannabis to some degree, albeit some of them super strict, super hard, but still some of them, maybe it's just Epidiolex and Sativex, still it did exist. So, I think that's just going to get more and more.
Yeah, and like you say, I suppose as kind of rules change, as things get rescheduled, descheduled, or just kind of, a different legal perspective is taken on them, then that almost kind of, negates any kind of negative argument. But again, it's still deeply entrenched, this kind of stigma. And again, like you say, even in countries where there's kind of stricter rules around medical cannabis, it's still going to take time for it to be, and if it feels like that kind of gradual crawl forwards, that's what I'd say. And again, it might be that, people at large, don't have a problem with it. But when it comes to kind of governments and thinking, well, how do we go about this appropriately? And it's, again, that just seems to be quite different each time in many respects. But I suppose that's, it's just interesting to see how it's all kind of evolving in that regard. But again, when I come back, when thinking about the UK in particular and thinking, well, how do we kind of evolve it? Again, when I was in Germany in the summer, and someone was saying it took us about 100,000 patients before, the authorities would kind of take seriously that there was, a need for recreational cannabis. And again, it's like, how do we almost have those sort of breakthrough moments, not necessarily for recreational, but again, to sort of say, well, actually, medical cannabis here is legal, more people can access it. And, even, I suppose there's a cost and kind of perception issues aside, it's like, how do we, get that message out there? And I don't think there's a simple answer. I think it's just consistently kind of just proving. Do you know what I mean? Do you feel like that's the only way to kind of cut through all of the noise around, the sort of dissent around cannabis, and just to kind of reinforce those positive messages and sort of say, well, look, this is what's happened here. Look what they're doing over here. Do you find that has been sort of piecing those things together that starts to build more of a persuasive argument for legalization?
Yeah, sadly, media is controlled on two sides of the spectrum, right? Whichever side you're on, you got one controlling message. Yeah. And there's very powerful, forces at play here. Imagine if you're, big pharma and you got a ton of money of lobbying money. Do you want somebody nicking at your, pain relief drugs? Do you want somebody, knocking, on your revenue line? There's already been enough proof, data out of the U.S. Any country, any states that have gone legalized with cannabis have a reduction in alcohol consumption. And so do you want your alcohol revenue numbers to decline if that's the powerful force behind it? And so, there's a lot of forces that are making these waves, and they have much bigger money, and it's easier to sow dissent in our industry than it is to build up our industry. And we just don't have the money to push it through. Even in Florida recently, Trulieve, one of the biggest player there, they put all the money in the lobbying efforts to try to get go from medical to recreational, and that wasn't even a dent in whatever powers were behind that to go the other way. And yeah, the media just kept repeating, oh, we don't want marijuana being smelt all over the place. Well, I've never even been anywhere where I've smelt marijuana all over the place. Even in California, it's not like I'm walking down the street and there's marijuana all over the place. People are smoking it, people are taking edibles, but it's not some pervasively bad thing which they portrayed on them. So we have less of a megaphone than the other side, unfortunately, but we got to keep pushing.
That's it. And then again, I suppose that again paves the way for acquisition potentially as well and things like that. And again, I always hear the arguments, people saying we don't want big pharma or big tobacco or big alcohol to kind of be involved in the cannabis industry. But again, that could be a beneficial thing eventually, but because, well, again, they've got the kind of the money, the distribution networks, the kind of lobbying power, as you sort of say. And again, that they would see cannabis as nipping at their sort of heels and encroaching on their market share is, again, that means they're worried to some extent, or they're prepared to do something about it eventually. And it feels like that can only be a more broadly positive thing for the cannabis industry moving forward. What do you think?
I mean, we had like Constellation Brands come in, with Canopy. That didn't work out so well for them. As a matter of fact, big cannabis imploded, and that would be a telltale sign that large-scale cannabis companies aren't necessarily the norm. And so the smaller players, I think, kind of took note. There's always going to be multiple niches in cannabis, even if it's homegrown, as an example. Like, I remember arguments where people would say, if you allow home growing, all the business would go. I was like, it's so complicated to home grow. This is so niche. But okay, big alcohol tried and whiffed with that. You have British Tobacco with Organogram, and that distribution model where Organogram's distributing their Canadian flower through investments made in multiple different countries, distributors. Philip Morris decided to go medical, and it went with that psych medical device. Well, that didn't work out so well either. I don't remember the valuation, $6 billion, but the sales are very anemic. And so, and then you have a few beverage companies. I think it was Molson, or I forget which one, but they have a cannabis beverage up in Canada.
The teapot.
Yeah, very little market share. So, their large money hasn't been the best influence. I think the best is British Tobacco's investment so far. But that's only helped to spread cannabis, throughout the medical communities in Australia and Germany and Israel and UK, I suppose, also. So, they've taken that approach, and that's worked out well for the industry. So it's hard to say. And there's always going to be some big companies, some medium companies, and a bunch of little companies. That's the way cannabis will go till the end of our days, I suppose.
But what's kind of your hope for sort of 2025? Because we're, time recording sort of coming up to December 24. Where are you guys going next? What's kind of going to be a big focus for you next year and beyond?
Yeah, we're living in 2025 now, planning out 2026 products. So 2025 is launching more products into the market. We have our vaporizer lines just started hitting the markets. Our oral gums will start hitting the markets also beginning of 2025. Plus, we have other lines of oral drops that will start to roll out also. So we have progression of products all throughout 2025. Our new flower lines hit. And then we have to keep expanding from to more countries. So there's the 3 big ones, but we have 7 more on the way. And that registrations could take, in some of these countries, 6 months, a year. Poland we've been waiting for a year for our extract to be approved. I know Switzerland just got their first order going. So, then, I'm hoping you're going to see the finalized rules in Spain. That's clearly our neighbor in a big country. As an extract market, that's going to be a monster.
Yeah.
France, they punted. So let's see if they open up to new registrations. But that's a registration market with a medical authorized dossier. So a 200-page document, proving your medicines like any medicine. So that's going to be an interesting one. I think Czech might even change. So there's a lot of countries that are looking at Japan, may end change to that strict CBD, but still they're going to legalize what's already been there. After 75 years, that's a major step forward in advancement. Maybe the Philippines comes online. Who knows? I think Indonesia's a creeper that might come out. There are the rumblings. But I think most of Europe is going to agree that at least call it a medical medium approach to a medical light approach is probably the best way to be.
Yeah, no, I think that sounds about right to me, actually, in terms of the way things are probably going to go. But again, it's it's cannabis, so there's always a surprise lurking around the corner. But it's what keeps things going, keeps things moving in interesting and novel ways. And that's always impressed me about the cannabis industry, like the ability to pivot and just kind of say, well, actually, we're going to do this now or do this. And I think again, it's part of the DNA, really, isn't it? I think, but it's never a dull moment, that's for sure. But
that's for sure.
Yeah.
I think at some point, though, the surprises are out of the way. The only surprise is timing to us, right? So that regulators, all over here, have read enough of it. There's 30,000 research reports out there.
Yeah.
I love when a doctor says to me, well, there's not enough research out. And I kind of look at him and smile and I say, well, sorry, but that's one of those ones that I don't agree with you on. There's plenty of research. It's just a matter of time.
Yeah, 100%. But no, thank you so much for coming on and telling us a little bit more about what you're doing. And wish you the best of luck. And I'm sure we'll speak again soon. So thank you, Michael.
Yeah, thanks for having me on, Dave.
Alrighty, cheers. Bye-bye.